In this lesson, we shall consider the buccal and sublingual routes of drug administration. As previously stated, the buccal and sublingual routes are classified under the enteral routes because the drug is administered into the gastrointestinal system. We shall now define the sublingual route. Sublingual drug administration entails administering the drug under the tongue, while buccal drug administration entails administration of the drug between the cheek and the gum. We shall now look at properties of drugs that are given sublingually. The first property is that the drug molecule should be highly lipophilic and should be a small molecule. These two properties are required because they lead to rapid and good absorption of a drug from the buccal cavity. Secondly, the drug should be palatable in order to avoid a situation where the patient spits out the drug because of a bitter and palatable taste. Thirdly, the drug should be absorbed well at the alkaline pH of the mouth. Generally, drugs that are basic tend to be unionized at alkaline pH and are therefore well absorbed in the buccal cavity. The last consideration is that the drug should be highly potent. Potency refers to the principle that only a small volume of drug is required for it to elicit activity. The buccal cavity has a small volume and therefore it can only accommodate highly potent drugs that have a small volume. We shall now consider an example of a drug that is administered buccally or sublingually. The classical example is nitroglycerin sublingual tablets. This drug is given for management of angina. Other examples of drugs that are administered sublingually include morphine, alprazolam, and cannabinoids, which can be given as oral drops. Crushed tablets of drugs that are designed for oral use can also be administered as a powder when placed below the tongue. In this slide, we are going to contrast the buccal and oral routes of drug administration. This will enable one to understand some of the advantages and disadvantages of the buccal or sublingual route. First, we shall consider the rate of drug absorption. When a drug is given orally, absorption tends to be slow and erratic. However, when a drug is given buccally, absorption is faster. The second property that shall be considered is the first pass effect. When drugs are given orally, there is a probability that they may be affected by first pass metabolism. On the other hand, if they are given buccally, the probability of being affected by first pass metabolism is reduced. When a drug is given orally, ideally it should be palatable, but fortunately there are more avenues for masking bitter and unpalatable tastes. However, if a drug is given buccally, the taste buds are continuously exposed to the bad taste, and the patient may spit out the drug. Therefore, when formulating drugs for buccal administration, considerations of palatability are very, very critical. We shall now consider the volume of the drug. When a drug is given orally, large volumes can be administered. However, drugs that are given buccally or sublingually should have a small volume because the volume of the buccal cavity is limited. Next, we shall consider the advantages and disadvantages of the buccal or sublingual route. Most have already been stated, but the first key consideration is that it avoids the first pass effect. This slide shows why the first pass effect is avoided. The venous supply of the buccal cavity drains into the superior vena cava, and therefore the drug is distributed into systemic circulation without necessarily going into the liver first. Because of this property, the sublingual or buccal route avoids the first pass effect. Other advantages are like for the oral route. So like the oral route, it is easy to give a drug buccally or sublingually. It's convenient, non-invasive, safe, sterility is not required, and no skills are required to use this route. The key disadvantages: one can only give a limited volume. The drug may be swallowed accidentally, and a limited range of drugs can be given sublingually. So we are through with this session on the sublingual or buccal routes of drug administration.